Hi, I'm Dr. Anthony Newton, and I'm a counselling psychologist at the Private Therapy Clinic. So, here at the clinic, we assess and offer support for borderline personality disorder, or BPD, as well as a wide range of other mental health issues that affects people's daily lives, their emotions, their relationships, and general well-being. So this video is to help you understand a bit more about the BPD assessment process, so what it involves and how it can help you to gain some clarity about your experiences. So BPD affects the way that someone is able to manage their emotions, as well as how they relate to others and how they experience themselves. So some of the symptoms of BPD can involve intense emotions, as well as difficulties with relationships, impulsivity, and feelings of emptiness or uncertainty about who you are. So because these symptoms of BPD can overlap with other mental health problems or conditions, getting a proper assessment ensures that you are able to receive the most helpful support and treatment at the right time. Why is a BPD assessment important? A BPD assessment can help us get a clear and accurate understanding of how you're experiencing your emotions, your relationships, and your sense of identity. Because BPD symptoms can deeply affect someone's life in terms of their work, their family and social relationships, as well as their overall mental well-being. And some people can struggle for years without knowing why, or for others, they could be misdiagnosed with something else. So for a lot of people, getting a BPD diagnosis is just for their own peace of mind. So a proper assessment can ensure that you receive the right treatment and the right support at the right time for you, because it's not uncommon for BPD symptoms to be mistaken for things like depression or bipolar disorder. But of course, there might be a combination of these things that are present as well, but an assessment can help to tease out and understand which is which and put people in the right treatment direction. So what happens at a BPD assessment? A BPD assessment is relatively structured, but also very tailored to you as an individual, because we want to see you as a whole person. So it can normally take place over one session, but sometimes we might have to extend that. Sometimes we have to see you for more than one session. The point is to get a full picture as to what's going on for you so we could best advise, and also not to rush anything and to not cause you unnecessary distress during the assessment process. So in terms of how it works, again, it's focusing on you as a whole person. So discussing who are you, what's going on in your life, what's brought you to the assessment, what have you noticed, or how are you feeling, or what have other people noticed that has sort of led you to the assessment. So you want to look at your current experiences, your current moods, your emotions, and your challenges. Of course, in an assessment, we look at your daily life. So what are you doing with your time? What are you doing with your days? And how are your relationships, your friendships? Are you able to maintain these? How do you manage ruptures in relationships or arguments? How do you repair them? That kind of thing. And also, we want to think about your personal goals. Or what are you looking to achieve? What are you hoping for? We will also look back at the past, actually. What's brought you here in terms of some of your earlier life experiences, in terms of your relational patterns in the past, your family life, family dynamics, as well as emotional. And how did you learn about emotions? What were some of your formative early emotional experiences? It's not just focusing on a negative or on the past, it's also looking at what are your strengths in the here and now? How do you get through the day? What do you enjoy doing? What gives you a purpose in life? And what are your coping strategies? What have you learned? What are you doing? We'll look at any previous experiences of therapy that you might have had or mental health support, because that really helps us to think about what's been helpful in those that could be brought forward moving forward, or what hasn't been helpful. Of course, we could maybe think about what could change, but your past therapy experiences could help inform your future ones. So again, it's not just about giving you a diagnosis, it's about trying to understand you as a whole person. What's brought you here? What's keeping you here? And how can we help you move through it? So in any clinical assessment, we always assess risk. So do you have any risk issues that we need to be aware of, that we need to consider, and how do we manage it as well? So are you safe from other people? Or do you have any concerns about anyone in your life? Are you able to keep yourself safe, during the assessment, post the assessment, in your life in general? What are your past experiences of risk or risky behavior? And again, it's about keeping you safe generally and giving you advice about what you can do to keep yourself safe if there is risk present. So again, it's about understanding what's keeping you going, what's supporting you, what's driving you, and yeah, just what is supporting you during this difficult time or during a time when you're experiencing difficult emotions. So it's not about judgment, it's just about ensuring that you feel safe and supported. So at the clinic, with our BPD assessments, we would often go through a diagnostic and statistical manual of mental disorders, or DSM. We'll look at their criteria and we'll see how closely do you match the criteria of what defines a borderline personality disorder diagnosis, essentially. So it's not a checklist, it's not a tick boxing exercise again, it's just trying to have some matching to what is considered to meet a diagnostic level, essentially. And also during our assessment, we will complete questionnaires with you. So questionnaires are quite commonplace in mental health or in psychology or counselling, just to get that measure, really, to see how things are changing over time and to add another layer, really, to the assessment in terms of what is going on for you. So in terms of what happens next or at the end, we will give you the chance to ask questions and clarify anything, go back over anything. The practitioner might share some initial thoughts with you in terms of what they've picked up or how they might see things and reflect on the information that you have provided. Sometimes the practitioner might need a little bit of time just to think about what has been said, and then they might get back to you with a report or a follow-up session to go through the findings with you. So regardless of the outcome, it's just about ensuring that you have a bit more clarity in terms of what's going on for you and to help you understand a little bit better some of your experiences. So what are the benefits of receiving a proper BPD assessment? Well, the first is just clarity. It's for you to understand, and others around you in your life, a little bit better about what you might be experiencing and going through. And obviously, once you have that clarity, that can support in accessing the right treatment for you or the right therapy or the right support. So you can start to make changes and start to just apply things to your life that can support you to be well, or to support you improve your relationships, or to support you manage your emotions better. And there's many different approaches that could be suitable, but typically it could be something along the lines of DBT, or dialectical behavioral therapy. There could be mentalization-based therapy, MBT. There could be schema therapy, or it could be another approach. It just depends on what's going on for you and what is decided and agreed upon together in collaboration with your practitioner. So the important thing to remember is that even if you don't get a diagnosis, that's okay too. It's just helpful to understand what is going on, and we would still always advise as to what the best support for you could be. So to conclude, a BPD assessment at a private therapy clinic really is just a conversation. It's a clinical conversation, a clinical discussion with a trained professional in a non-judgmental setting or manner. We do go through checklists, DSM checklists. It is slightly structured, but it is also personalized to you. We want to understand you as a whole person, your whole life and your experiences. We do, of course, complete questionnaires, as we commonly do in psychology and in mental health. And the focus really is just to understand your experiences, strengths, and challenges in life. So it's not just about a diagnosis, it's a little bit more than that. And really, we'll offer you guidance as to what you can do in terms of what is the next best step in terms of therapy or support. We might not have the answers immediately, but we can certainly have a think about it over time and get back to you. So that's generally the process. So if you'd like to learn more about BPD assessments, to book a session, then please contact us at www.theprivatetherapyclinic.co.uk and drop us a message, send us an email and get in touch. We'd love to hear from you. So thank you so much for watching and take care.